Thanks very much. Minister, welcome to the House. I am disappointed, notwithstanding the fact that you've taken your time, that Minister Varadkar himself isn't here for this very important issue. Some weeks ago I raised with him the issue of ladies who were being referred to the symptomatic breast clinic in University College Hospital in Galway being effectively sent back to undertake a form-filling exercise and effectively self-monitor for a 3-month period. I was expressing concerns at the time that this was a critical time that could be lost to those people if in fact they were among the 7% of people who would go on and from nostalgia or breast pain develop a more serious problem, underlying problem of breast cancer and so on. Minister at the time very worryingly described my particular client as the subject of an inappropriate referral. Now that proved not to be the case and went off and funded her own, because luckily she had the funds, to have a private assessment done, and thankfully all has happened to be well. She's not one of the 7%, but I posed the question rightfully at the time, what about those who are? Today I think we've had an even worse situation where another lady has come following the press coverage of me raising it here with Minister Varadkar the last time he was contacting me, and I'm going to read most of her email into the record of the House, which I think speaks for itself. On reading the article, I felt a pang of personal concern, as I am currently on the public waiting list to see a doctor in the Galway Breast Clinic. Initially I was told by the clinic I would only be 4 to 6 weeks due to the fact I was referred with a lump and discomfort in each breast, and I am in the high-risk group. The clinic confirmed on the day of my appointment to see the doctor if any tests, mammograms would be completed. The clinic confirmed on the day of my appointment to see the doctor that required tests, mammograms would be completed. After 6 weeks passed, I recontacted the hospital to learn that it may be up to the next February before I see a doctor, and any tests I may require will not be completed on the day. The lady was very kind, she says, and said to contact her GP. But the list, she also said that the list realistically is highly unlikely I would be seen before Christmas. Earliest maybe January, and more likely the end of February. This is the lady's own words. I am now quietly scared and worried. I had an encounter with cancer over 10 years ago, and it was early detection through the public system that prevented me having to go through a lot of treatment, surgery and careful monitoring. I am doing my best to stay positive. I do understand and take on board that over 70% of women with lumps and discomfort are usually okay. At the back of my troubled mind is the little nagging doubt. When I get to Galway, will I have lost vital time? Minister, those words are compelling and they speak for themselves, and while I appreciate your area's environment and not health, this is an area that demands the highest action by government. As you know, we've had a debacle over the last number of years, the shutdown of various breast clinics, the setting up of other breast clinics, the so-called centres of excellence, and now in a matter of a couple of weeks we have had 2 instances, one who has had cancer before effectively, that are in the high-risk age groups, being put on the never-never. One has been sent a booklet to self-monitor and fill out forms. The other, with more serious symptoms in terms of lumps and pain, has been told, look, we'll get to you perhaps by the end of February, and to know we won't be doing all your tests on that particular day. There are also reports that the symptomatic breast clinic in Letterkenny is only seeing 16% of high priority patients within the required time frame. Minister, I needn't tell you that while it's important to portray that the health system is going well, and when one is lucky enough to get within the service, I agree that the health professionals probably are doing very, very good work with people. But it's simply not acceptable for us, perhaps in some way, to try and massage waiting lists and so on, to put patients like these 2 ladies at risk. I'm sure it's certainly not your personal intention. I've worked with you here in this House when you were a senator. But I think it's simply unacceptable that Minister Varadkar's approach to this, when first raised a few weeks ago with a different patient, was he spoke of inappropriate referrals. You've heard this lady's own words. Someone who's had a brush with cancer before, somebody in the high-risk age group, and they too are being put on the never-never. So, Minister, I would ask, again, I know it's not your core area, but I would ask that when you leave here today, that you immediately contact Minister Varadkar, if not the Taoiseach as well, to ask that the appropriate interventions be made in the first instance for this particular patient, and I've written to Minister Varadkar about her, and also to see how many people are in this space purely because it would seem that we don't have the resources to deal with it within the Galway, Letterkenny, North West and Sligo areas. Later in the day, we will amend the order of business to bring Minister Varadkar to the House on other matters to do with health, and I might have an opportunity to raise it with him. But this isn't the appropriate forum, and I don't want to take from the importance of this issue. Thank you.
Thank you, Cathaoirleach. And first of all, I want to thank Senator MacSharry for raising this important issue and giving me the opportunity to update the House on the matter, which I am taking on behalf of Minister Varadkar, who gives his apologies that, unfortunately, he cannot attend this morning. The Symptomatic Breast Clinic at University College Hospital Galway is part of a range of services that are in place for women with breast symptoms. Referrals are dealt with in accordance with the guidelines that have been developed by the National Cancer Control Programme, otherwise known as the NCCP. Most women experience breast pain at some stage. While this can cause worry in the absence of other symptoms, breast pain, it is found, is rarely indicative of breast cancer. The NCCP, in collaboration with the Irish College of General Practitioners, developed a booklet to support women with breast pain. This booklet explains the types of breast pain, their possible causes and how pain might be easily remedied. The booklet contains a 3-month diary to help determine whether the pain is cyclical or non-cyclical, as this information can help with prevention and care. This approach is evidence-based and is regarded as good standard practice. The booklet highlights the importance of making a specialist referral if other symptoms are present in addition to the breast pain. GPs have also been provided with a guideline for managing breast pain in primary care centres. The guideline contains the same advice as that in the patient booklet. Where the patient's clinical examination is normal, she is asked to follow the advice in the booklet for 3 months. If, after that time, the pain has not been resolved, a referral is then warranted. All referrals to the symptomatic breast clinics in Dublin, Cork, Waterford, Limerick, Galway and Letterkenny are triaged on receipt, and appointments are then offered. Breast cancer survival in Ireland has improved significantly in recent years due to a combined approach of screening, symptomatic detection and improved treatment. Breast cancer 5-year survival is now estimated at 81% for women diagnosed between 2006 and 2011, which represents an increase from 72% from women that were diagnosed between 1994 and 1999. Last November, Minister Varadkar announced the extension of breast check to the 65 to 69 age group in keeping with EU guidelines. I am pleased to confirm that the first invitations have issued and the screening of 500 women in this cohort will take place this year. Earlier this year, Minister Varadkar also launched the National Clinical Guidelines on the diagnosis, staging and treatment of patients with breast cancer. Clinical effectiveness is fundamental to our health service. Implementing good quality clinical guidelines and audit can improve health outcomes for patients, reduce variations in practice and improve the quality of clinical decisions. In conclusion, Cathaoirleach, Minister Varadkar has asked me to assure the Senator that all women with breast symptoms are welcome at specialist breast services, including women with persistent and troublesome breast pain as outlined in the guidelines. Cathaoirleach.
Brief question, Senator.
Yeah, what about lumps? We didn't hear anything about that. I know it's not your core area, Minister. Again, the words of the lady, when I get to Galway, will I have lost vital time? These patients aren't being referred by lay people, by traffic wardens, by people in the street. They're being referred to by medical professionals with 7-year training. So, I'm bound to say that, these delays and the speeches here today and by Minister Varadkar about best medical practice just don't stack up. And again, there's no mention of the individual patient, which I would ask Minister's office will be aware of it, if you could specifically raise that person who is literally on the never-never to have breast lumps and pain. So it's not just nostalgia. And I'm afraid the form-filling book reading exercise is not one that gives confidence to the ladies of the North West of Ireland. Thank you.
Hello.
Can I say, look, I welcome the fact that the Senator is raising what is a very important matter. I think any of us that are elected representatives will take the opportunity to, I suppose, identify that cancer is a huge challenge for any family that's touched by it. And you quite rightly state that where people have lumps in their breasts, if ladies have lumps, that there is a concern around that. And it is important that there is early intervention and diagnosis to deal with any problems that might arise. I just want to reiterate for the Senator what the Minister has said. And he has said that he wants to assure the House that all women with breast symptoms are welcome at specialist breast services, and that includes women with persistent and troublesome breast pain, as outlined in the guidelines. But with regard to the specific case that the Senator has raised here this morning, I am happy to relay those concerns to the Minister directly, and I will do that and undertake to do that. Thank you,
Thank you, Minister.